You've just been told that you need to see a counselor or a psychiatrist, a mental health professional, because of your particular challenge or issue. And that's about all the information you have. Do you know what choices you have? What do we mean when we say a mental health professional? Are you nervous about what to expect? Do you even know what's meant to be happening when you get there? How do you get there? What is the whole arena about when it comes to working with mental health professionals as somebody who has been sent to them, meaning you're a client or a patient? Okay? Today we're going to help you understand your mental health professionals. You're going to know what qualifications and what they can or they can't do. We're also going to talk about what to expect in the session, because we get very nervous. We have absolutely no clue what to expect, and because of that we cannot take charge in the session in terms of being aware and being able to communicate without fear or anxiety, so that you are well informed and prepared before going to your first session with whoever it is that you have picked to work with you. Welcome to the Shibero Show, where we talk about the issues that affect our mental wellness. I am your host, Shibero Akatsa. Do stay tuned in, because this could help you or somebody you might know. Karibuni sana. I remember my very first session with a psychotherapist. I was so nervous. First of all, I had no clue what to expect. But also, I already had all this other stuff that was going on for me. So I wasn't in a very good space. Nobody had actually told me this is what is meant to happen and this is how you're meant to look for a therapist. So I just went to the first one that had been told, go see this person. So there was quite a bit of added anxiety to that very first session with a psychotherapist. I'm sure even as I'm talking, some of you might be able to relate, because we do not know much about what that first session is going to be. There are many different kinds of mental health professionals, and I would really like you to understand when you go into a session, or when you're told go and find a counselor, that again it is taking it into your hands. It's your responsibility to find out what is meant by mental health professionals, because there's quite a number of them. You need to find the right one for you, which does require research, not just going along with what somebody may have recommended. This is really important, because there are times when I have had clients come to me and they've had some pretty horrendous experiences with people that have been told go and see. Here you actually do your own research and ask the right questions. But let's first of all start with the list of the different mental health professionals, so that you understand when you go to see a mental health professional what their background is meant to be, if they are to do the job that they have been trained for, or if they are to help you properly and effectively then you really do need to also know something about them. So it's not that one way I am telling you everything about my sorrows. You need to know also where they are coming from. This gives you some power as well, in being able to say, oh, hold on a minute, I don't necessarily agree with that, because they're not always right. We're not always right. Okay. So you'll be able to understand the differences between the different mental health professionals. The following provide psychological assessments and therapy. However, they cannot prescribe. Generally, they can't prescribe prescriptions. So I'll just let you know which people can and which people can't. But these mental health professionals are not meant to be prescribing you any kind of prescriptions yet. A clinical psychologist, first of all, what is their background? They've had a degree in psychology. They should have a professional degree in psychology from an accepted program in psychology. They should also be trained to make diagnosis and provide individual and group therapy. And when we talk about making diagnosis, it does not mean that they tell you what to do. They don't tell you what to do, but they listen to your story and they're able to diagnose what it is, what model they are going to use with you, or how can they best help you. It's just like when you go to a doctor. Basically, a doctor will diagnose you and tell you this needs to happen, this needs to happen, this needs to happen. But also with clinical psychologists who are trained, because not everybody in this town is trained. Please be careful of that. They should be able to diagnose and provide individual or group therapy. That is a clinical psychologist, yeah? We usually hear this name being bantered, thrown around, and we have absolutely no idea what it is. We just know that, they're meant to be working with our mental health. The next one we have is a counselor. I want you to be aware of the fact that they are licensed professional mental health counselors. And with these counselors, normally they have either a master's degree and several years of supervised clinical work experience. They are also trained to diagnose and provide individual and group counseling. There are too many counselors in Kenya, from my experience, who go for 3 to 6 months training, because there are very many people who are also providing counseling courses. But you have to be really careful that you're not getting one of those kinds of counselors, because they do not actually diagnose, nor do many of them provide individual or group therapy. If they do, then they're not meant to be, because they're not qualified or experienced as to how to deal with your mind. Don't just let anybody come and deal with your mind. So those are the licensed. Remember, they are licensed professional mental health counselors. They need to be able to diagnose and then be able to work with individuals and groups. Yeah. The next one we have is marital and family and relationship psychotherapists or clinicians. Usually, again, this calls for a degree in marital and family therapy. Not just anybody can talk about these situations. It's more than just a physical situation that you are bringing. There's a lot of underlying grounds, underlying things underneath your situation that a trained clinical family and marital psychotherapist is meant to be able to again diagnose and identify. Please remember, we're not talking about helping skills and giving you advice, because anybody can actually do that. So make sure that if you're going to see somebody about your marriage, they also need to be qualified. And again, I would go as far as saying a degree in marital and family therapy, and they have been trained to diagnose and provide you or a group in counseling. They should be able to do that. No Mickey Mouse. There's too many Mickey Mouses, and I know I'm going to keep saying this because I've come across them. Then we've got people who have been trained and who are certified in alcohol and drugs abuse, or in abuse, or in trauma, and they have actually gone through training and are qualified to deal with your trauma or to deal with alcohol and drugs abuse. Again, they are trained to diagnose and provide individual and group counseling. The groups that I've just read to you, let's just have another look at them. The clinical psychotherapist, the counselor, the licensed professional counselor, the marital and family therapists, pastoral counselors, other therapists who are, qualified in things like alcohol and drugs abuse, and other forms of therapists like art therapists, music therapists, or counselors. They do not prescribe medication. So please be careful when somebody tells you to actually go on medication. They are not qualified to actually ask you to go on some kind of prescription. Okay? These particular mental health professionals can prescribe medication, the ones that I'm now going to go to read to you. However, they may not provide therapy or counseling services. And the most common that we know is a psychiatrist. And you'll find that psychiatrists are meant to work with counseling psychologists. And again, I'm talking about the situation as it's meant to be, the ideal situation. I know that there are quite a number of psychiatrists out here working on their own. But ideally, they're meant to work with somebody else, like a clinical psychologist, who is able to work with your mental. And then the psychiatrists, what they do is they actually diagnose and then they prescribe the medication according to, what they've found you need medication-wise as well. So what is a psychiatrist? A psychiatrist is a medical doctor with special training in the diagnosis and treatment of mental and emotional wellness. They can prescribe medication, but they often do not counsel patients. They work with clinical psychologists or psychotherapists alongside their patient. They call them patients, psychiatrists call them patients. Clinical psychologists and counselors, we call them clients, yeah? And then you'll find that there are psychiatric mental health nurse practitioners, and they are registered nurses, again with a graduate degree and specialized training in the diagnosis and treatment of mental and emotional illnesses. I guess what I want you to understand is that they need to be qualified And you have every right to ask whether they are qualified or not. Yeah? And you need to understand that not everybody within the mental health profession can actually give you medication. So we've got different levels of mental health professionals. What I've seen being practiced a lot are people call themselves counselors, but actually use self-help skills or helping skills, but they're not trained. So it becomes more of an advisory telling you what to do. We have to be really careful with those kinds of counselors, because they're not necessarily applying any kind of model, or they're not necessarily trained to be able to understand what goes on at a psychological level, only at a physical level. So remember, please do your research. Too many people are taking those 3 to 6 month counseling courses and calling themselves counselors or therapists, or that's just too much juakali going on around. Remember that your mind is very, very sensitive. You need to know, who am I working with, and are they qualified to start messing about with my head? Because when you go there, you are so vulnerable, and you are ready to actually allow anybody, or not anybody, whoever has been recommended to you to work with you. But you have a choice. You need to ask questions about their qualifications, about their experience. And by the way, many of the clinical psychologists or counselors also need to be having their own personal, we call it work with, they need to be supervised as well. And they need to find a way of working with a supervisor in helping them deal with their own stuff, their own baggage. Because if you have somebody who's counseling you and they are not working on their own stuff, their own baggage, it's very easy for it to come out on you. It is a very sensitive environment, and it can end up being quite abusive because of what's going on for that particular person, for them to dump it on you and use the way that they would be using to solve their issues to solve yours. That is completely wrong. It's completely wrong. So please do research on who is this person, what is your background in mental health, are they qualified, and you can even ask what their qualification is. You have every right to do that. Do not leave it. Don't leave it unspoken. Ask questions. Don't leave it in the power of your mental health professional. It is a two-way. You work together. It's a partnership. You have a choice. You do not have to work with them. As soon as you start feeling uncomfortable, then you know what? It is okay to actually say, let me have a think about it. And you don't have to necessarily go back to them, but find somebody else. Do your research, please. Yeah? When making the call to the mental health professional, because this is what will happen, you'll be told, oh, I've got such and such a person, why don't you try them? Remember, why don't you try them? Talk with him or her on the phone, or maybe you might even meet face to face, but the first thing you do is you actually make a call. Ask about their approach to working with patients, with clients. Ask, what approach do you use? You'll be surprised that there are some who don't. They would be surprised that you're actually asking such a question, but ask. Yeah? Even ask them what their philosophy is. This is about being aware of what your needs are, and you want the best for whoever's going to work with your mind, because the mind is not it's very complex. It's very complex. Ask them whether they have a speciality or concentration Because if it's somebody who works on alcohol and drugs abuse and they want to therapy you in relationship and family, just hold on. It's like, hold on a minute. Or if it's somebody who is in relationship, family, therapy, it's like, hold on. You want somebody who is qualified in alcohol and drugs abuse, or who's qualified in child abuse, or who's qualified in abuse. So please ask. You know what your needs are. Feel free to ask, are you qualified? And you'll be able to tell from the way they respond to you. Remember, when you make that first phone call, it is not the time to talk about your issues. You are only doing your research. After you've done your research, when you go in for the first session, that is when you will talk to your counselor or your psychiatrist or your clinical psychologist. If you feel comfortable talking to them, the next step is to make an appointment. If you feel uncomfortable, don't make an appointment with them. Do not put additional pressure on yourself. Okay? So what happens on your first visit? Normally the counselor or the doctor, i.e. the psychiatrist, will want to get to know you and why you called him or her. This is where now you tell your story. They'll want to know what you think your problem is about your life. What they want to know, all the administration things. What do you do? Where do you live? With whom do you live? It is also common to be asked about your family and friends. And when you're asked these questions, what we're trying to do is to ascertain what your support mechanisms are, support systems around you. But we're also trying to find out how you perceive your issue. And this leads to helping us understand how we can help you. Okay? So this information helps the professionals to assess your situation and develop a path of treatment. If you're working, I work with clients, and I tell them my minimum number of sessions, which is usually 8. And if there isn't any kind of movement by the 8th session, then I will ask you to go back to your drawing board. There are those who work open-endedly, and because of this, you usually don't know how long it's going to go on for. So always ask as well, how many sessions do you think we will be able to have before, there should be or there can be changes. Yeah, and find out whether or not they've got a minimum amount of sessions as well. Okay. If you don't feel comfortable with a professional after the first or even several visits, talk about your feelings at your next meeting. Please do not walk away feeling you cannot talk about it. This is where it comes to being emotionally intelligent. You've got to learn to be able to say, I feel uncomfortable about this. I feel uncomfortable about that. Do not let yourself get into a place where there is some kind of abuse going on within that relationship. And it's very easy for, there have been quite a number of abusive therapists and abusive counselors who've ended up in relationships with their clients because they've got, we've got the position of power over you. And when you come, you are so vulnerable. But remember, you can say what is on your mind. You've got to learn how to say, this is what I feel. And if you're not happy with what's going on, you have got to say it. Okay? It's just about learning how to bring out the things that are disturbing you. finally, please remember, do not be intimidated by your counselor, psychiatrist, or your therapist. Feeling uncomfortable with the professional you choose to work with you is very important to the success of your treatment. Remember, it is your story and you work in partnership with your mental health professional, whoever you choose. But remember as well that you have a choice. Do not feel under pressure to go with anyone that you are uncomfortable with. So till next time, don't forget to share this information and to subscribe to our channel. Also, do visit us at shibero.com and on our Facebook page as well. Go like and share. Till next time, God bless you. Remember, do not be afraid of your counselor, psychotherapist. Take charge. God bless.